To be an instrument of healing, hope, comfort, and cure is a nurse's gift to the world. Nurses come as a ray of sunshine to the sick, a source of hope to the weary. They are an embodiment of selflessness. Their profession is not necessarily lucrative, but what they derive from it, the genuine connection that they are able to establish with people from the conditions that they are in, to how life can still be beautiful for them, is among the priceless benefits that make nurses fulfilled. Good day everyone, I am Maureen Marie L. Dallin. So today I'm going to discuss about synchronicity in human spacetime, a theory of nursing engagement in a global community, by Freslyn, Lim-Saco, Clifford, Kilat, and Rozzano, Locsin, in International Journal for Human Caring. Freslyn Lim-Saco was born on June 1, 1983. She spent her education years in Silman University from elementary until college. With the demands of the academe and her interest in professional development, she took up and completed in 2011 her degree of Master's in Nursing, major in Nursing Administration in 2011. She currently works at the College of Nursing in Silman University. Freslyn uses phenomenological hermeneutics inspired by the theory of interpretation by Paul Ricoeur. Her dissertation is about the meaning of nurse caring for persons sustained with technologies at the end of life. Clifford Masayon Kilat was a PhD student in Silman University and has a skill and expertise on qualitative analysis, academic writing, research methodology, quantitative analysis, research analysis, qualitative inquiry, research proposal writing, quantitative data analysis, research papers, research paper writing. Rozzano Locsin was born in 1954. He is a registered nurse, a native of Dumaguete City, Philippines. He earned Bachelor of Science in Nursing from Silman University in 1976, then his Master of Arts in Nursing from the same university in 1978. In 1988, he earned his Doctor of Philosophy in Nursing degree from the University of the Philippines. The human spacetime theory is a study of caring and the perspective of synchronicity and nursing engagement. This theory aims to enlighten nurses in their practice through an innovative demonstration of nursing care processes grounded on authentic intentions of caring transcending extent reductionistic approaches. The synchronicity in human spacetime, a theory of nursing engagement, acknowledges how each is being cared for through meaningful connectedness, regardless of the external influences or environmental limitations. Illuminates the persistent caring elements of nursing. Major concepts and important principles. First is synchronicity. Exists through meaningful connectedness of these human health experiences and the consciousness of human, environment, and time elements. The next one is human space-time consciousness. Honors caring, healing, mindfulness, and wholeness of persons in health, dying, and that co-create meanings, design rhythmical patterns, and co-transcended possibilities. The four principles of synchronicity in human space-time, a theory of nursing engagement, are interconnectivity, equitability, emancipation, and human transcendence. Interconnectivity is a principle of human interconnectedness energy. Energy is a continuously moving from subatomic particles to the biosphere, including the planet Earth, all forming a whole. Interconnectivity spiritual conditions, while the external environment limitations refer to the socio-economic political challenges, as well as the organizational dynamic that influence the nurse and the nursed. The time limit is indicated by the constraints it has on every person, such as how long it takes for the nurse to spend for every patient before his or her shift ends, or on the part of the patient how long it takes for him or her to stay in the hospital bed. Another principle is human transcendence. It indicates personal growth of persons and professional growth among nurses. Faris described the characteristics of growth as assertion to self, to emancipation of self, to transcendence of self. Through human transcendence, human and the nurse can rise beyond their present difficulties, just as self-transcendence is revealed in the expansion of self-boundaries that enhances well-being. Human transcendence is also evident in the ability to go beyond the limits of the human space-time through a nursing engagement that fosters human health and well-being. Another principle is equitability, is a principle of justice and fairness in human caring across healthcare system. It revolves around the value-based concept of equity, implying fairness in access to healthcare related to the situated context despite differences in methods, utilization, and outcomes. It can also mean fairness in access to services within an organization. An understanding of the interconnections among space, time, movement, and consciousness as health manifestations leads to meaningful relationships within the human space, time, and beyond. When there are meaningful relationships of persons among patients, family, and healthcare team, the nurse is enabled to express equity in nursing care through prioritization, triage, and cost effective measures in the process of nursing engagement. And the last principle we have is emancipation. Is a principle of liberating the self and others from the limits of human space-time realities. The human space-time realities of healthcare could include human factors or attributes such as fear, shame, lack of communication skills, lack of knowledge, powerlessness, and human resources. Space factors could mean internal and external environmental limitations. Internal environmental limitations are physiologic, emotional, and sensing expression of caring intentions and technological competency are emphasized in the application of human caring through the nursing education practice and across healthcare systems worldwide. The four principles of interconnectivity, equitability, emancipation, and human transcendence are threaded through all of the process in the nursing education practice. As an iterative, nonlinear process of nursing engagement, interpersonal relating, technological knowing, rhythmical connecting, and transformational engaging can coexist and overlap. Amidst technological advancement in healthcare, the five caring elements of the dance of caring persons, caring moment, responsive leads to the understanding of holism, that the biopsychosocial spiritual dimensions of persons are interrelated, and that the whole being is more than the sum of its organs or system. The nurse does not only focus on the biological curing, but considers the healing aspect of the whole person's being. The nurse becomes more cognizant of the whole integrated person, interacting with and influenced by both internal and external environments. Applying the principle of interconnectivity through interpersonal relating, technological knowing, rhythmical connecting, and transformational engaging, the nurse embraces meaningful connectedness with their patients as whole persons. With the coexistence of human caring and technologies, with the synchronicity among modernist and postmodernist nursing care approaches, and with transformations across nursing engagement. Assumptions of the theory. The assumptions of synchronicity in human space-time, a theory of nursing engagement, and the relationship with the nursing engagement process illustrated below. Synchronicity in the human space-time consciousness, interconnectivity of persons, and nonlinearity of human caring experiences in nursing are all integrated into an equity-oriented healthcare system. Within this framework, nursing praxis has transcended the traditional medical-oriented view. Furthermore, human beings are viewed as integral to space-time and their experiences. Nursing theory, research, and practice have been advancing together with the progress demanded from within the human space-time, in which nursing praxis unfolds a unitarily developing pattern. The irreducibly evolving lived experiences and energy fields foster human transcendence between the nurse and the nursed. Moreover, meaningful connectedness within the human space-time consciousness of radiating energy fields, and the development of nursing practice are pandimensionally transforming in an open and nonlinear pattern. Under the lens of unitary transformative paradigm in nursing, the synchronicity in human space-time theory of nursing engagement asserts the following assumptions. The first assumption is human space-time is a metaphysical sphere of caring experiences among persons, with patterns of occurrence viewed as meaningful for both the nurse and the nursed. The human space-time consciousness of caring experiences is similar to Watson's caring moment that transcends space and time, as well as parses human universe viewpoint that is indivisible, unpredictable, and ever-changing in co-creating reality of becoming. The theory claims that synchronicity and nursing engagement occurs through the appreciation of the integrality of human environment and the time being. This is illustrated, for example, as synchronistic nursing engagement in various settings, for example, in the emergency department, community setting, or in a hospital ward. Perceiving the patient not as a disease or a product of some stereotypical clients, rather as individuals whose internal and external wellness are connected. The second assumption is nursing unfolds in a unitarily pattern of wholeness, integrated within the human space-time processes. Humans are assimilating their lives with technology, instigating the nursing profession toward transformations. The conceptualization of caring, nursing, and technology by Locsin elucidates the nursing profession as continually evolving here, now, and beyond. The third assumption is the nurse-nursed human space-time consciousness is irreducibly evolving, thus co-creating human transcendence. The individual experiences and perspectives of the nurse and the one being nursed are not deductively viewed apart from the whole nurse-nursed relationship. Nurses in their practice share the struggle with the people with resilient attitude. In this situation, both the nurse and the people's experience influence the hope for understanding of the nursing engagement. The theoretical assertion is that human transcendence mediates the relationship between resilience and well-being, and that the human space-time consciousness of persons is the driving force that pervades the sense of faith, hope, and love in all processes of nursing engagement. The theoretical assertion is that human transcendence mediates the relationship between resilience and well-being, and that the human space-time consciousness of persons is the driving force that pervades the sense of faith, hope, and love in all processes of nursing engagement. In nursing engagement, the lived experience of self and other is honored, human dignity is sustained, humanity is preserved, and wholeness of persons is held within human caring, transcending the limits of space, time, illness, diagnosis, socio-political conditions, and technological advancements. The fourth assumption is synchronicity in human space-time in nursing engagement is a pandimensional transforming process of interconnectedness among humanity. Based on the tenets of the Rogerian science of unitary human beings, pandimensionality is viewed as a nonlinear domain without spatial or temporal attributes, and transformation is the outcome of the ever-evolving human transcendence. Synchronicity in the human space-time exists within the dynamic transcendence of human beings, space, time, and the emerging variables around the universe. Within this theory, nurses appreciate the progressions in the healthcare system, including the individual's participation in human caring within technological advancements. In other words, nursing informatics, telehealth, big data analytics, robotics, thereby espousing that caring praxis in the synchronicity of human space-time in nursing engagement takes full advantage of resources, optimizing the potentials of humanistic nursing care regardless of future social and environmental demands. Under any circumstances such as nursing shortage, ethical dilemmas, administrative and political biases, expression of nursing actions and intentions of caring are inseparable, optimizing human health and well-being. The meta-paradigm of the theory. In nursing, exemplifying nursing as integral to human health and well-being in a global community, and equity in providing care. In person, the nurse embraces meaningful connectedness with their patients as a whole persons, with the coexistence of human caring and technologies, with a synchronicity among modernist and postmodernist nursing care approaches, and with transformations across nursing engagement. In health, unveiling the dynamics that sustains inequity creates the freedom to see and act in a way that improves the health for all. In the environment, internal environmental limitations are physiologic, emotional, and sensing expression of caring intentions, and technological competency, while external environment refer to the socio-economic political challenges as well as the organizational dynamic that influence the nurse and the nursed. Acceptance of the theory. In practice, this theory provides insights and answers into how nurses provide care and active relationship with patients beyond their customary, fragmented, and routinary healthcare commitment. In education, it can guide nursing students as well as nursing educators in affirming the meaningful human caring experiences within the nursing practice and focus on the coexistence of technology and caring in nursing. In research, the theory significantly describes process of nursing in guiding disciplinary nursing praxis and to rationalize the appreciation of nursing as a discipline of knowledge and a practice of profession. Analysis and evaluation of the theory. In simplicity, the human space-time is a study of caring and the perspective of synchronicity and nursing engagement. This theory aims to enlighten nurses in their practice through an innovative demonstration of nursing care processes. In generality, synchronicity in human space-time is a middle-range theory that provides concepts and principles about interconnectivity, equitability, emancipation, and human transcendence. In empirical precision, the concepts and principles in this theory is convenient and easy to access. Caring is essential. It has led to the development of several caring theories. It is centered around helping the patient gain a higher degree of harmony within the mind, body, and soul. It is achieved through caring transactions. It is with that belief that nurses care for patients in the hope that we contribute to the cure or well-being of the patient. Derivative consequence. As a pan-dimensionally transforming process, the synchronicity in the human space-time nursing engagement will continue to advance the nursing praxis and pervade the cosmos of meaningful connectedness among humanity. Here are the references. Thank you for listening and have a nice day.